down what we know about the current measles outbreak. I know in real numbers it's not a lot of people, but it is still troubling.
Yes, it is troubling because this is completely preventable. What we're seeing is one of the places in Texas that has the lowest vaccination rates, the highest school exemption rates from measles vaccination, having a measles outbreak, including hospitalizations of individuals who've been infected with measles. And I think this is really a reminder that measles is still a risk, and it is kind of the canary in the coal mine. It's the most contagious infectious disease known to humans. And when we start to see measles outbreak, that's a sign that there is a chink in the armor of vaccination. And the fact that it's preventable, I think, is what people should understand. This doesn't have to happen if we can get vaccination rates back to high levels again.
Doctor, we're just showing images coming into us from Gaines County, Texas, and we see the EMS workers. They're in full hazmat gear. What is the risk to adults? I'm vaccinated against the measles. My 2-year-old and my wife are vaccinated against the measles. She can't go to school here in New York without receiving that vaccine. But what would happen? I'm just amazed that those EMS workers are themselves wearing full hazmat suits.
If somebody is fully vaccinated against measles and has a normal immune system, they don't need to worry about measles. They're not going to be at risk for contracting measles because the vaccine is very, very effective. It's those individuals who are not vaccinated, or maybe they're too young to be vaccinated, or their parents have chose not to get them vaccinated. Those are where we start to see the cases. And I think they're just using kind of standard precautions there. But it is something that we take seriously when there are measles outbreaks. And think about all the public health resources that get diverted to deal with the measles outbreak that could be working on influenza, that could be working on COVID, that could be working on Mpox. They're now working on something that they shouldn't have to work on. This is something that should have been put to bed in the 1960s with the advent of the current vaccine.
Break down